Bites and stings. Introduction. A 2-year-old girl is brought to the emergency room with a red mark on her leg. She is too young to explain to anyone what happened to her. Her parents believe some kind of animal bit or stung her. How does an emergency room doctor identify the culprit that caused her injury? Jude McNally is the managing director of the Arizona Poison and Drug Information Center in Tucson, Arizona. He studies things that are poisonous or harmful to our bodies. Let's talk with Jude to learn about bites and stings in the desert. Life-threatening bites and stings. Interviewer: what happens first when a patient, such as this young girl, is brought to the emergency room? Judd. Doctor look for symptoms of life-threatening bites and stings. They are looking for symptoms caused by four possible culprits: black widow spiders, scorpions, insects that fly and sting, and rattlesnakes. Interviewer: what do doctors look for in the cause of black widow? Even though all spiders produce Even though all spiders produce venom, most of them can't get that venom into people. But the black widow spider, especially the female black widow, can inject venom when it bites. Black widows cause a burning, stinging pain at the site of the bite. There is not much smelling, and you can't see major puncture wounds. Muscle cramping begins, usually in the area of the sting, and it is especially bad in small children. A child will get muscle cramping all over his or her body. Sometimes the belly looks stiff like a board, and sometimes breathing becomes difficult. Children can also get puffy eyes. We rule out we rule out black widow spider bites when there is any muscle cramping. Do you know? Black widow spiders are not affected by many insecticides, which are chemicals used to kill insects. Remember, spiders are arachnids, not insects. Interviewer: what symptoms would you see in the case of scorpion stings? Jude: we have over 30 different kinds of scorpion in Arizona, and only the bog scorpion can be life-threatening. A 2-year-old child stung by a bog scorpion will be restless and won't be able to sit still. We'll often see muscles twitching, especially around the mouth. Another obvious symptom is roving eye syndrome, not being able to focus the eyes, and we'll see movement disorders, where a child will look as if he or she is doing a strange dance. Other scorpion stings cause local swelling, but the bog scorpion caused almost no reaction at the site. With a 2-year-old child, we do a tap test. We run our finger up and down the child's body. He or she will scream when we find the site of the sting because it is so painful. If we look carefully, we can sometimes see a single puncture wound. We rule out we rule out scorpions when restlessness, twitching, and roving eye syndrome are absent. Interview: what do you look for in the case of flying, stinging insects? With bees, wasps, or ants, we are concerned about allergic reaction. Most people get some redness, itching, and swelling at the site of a sting that goes away in a couple of days, but a reaction anywhere other than at the site within the first hour is considered a type 1 allergic reaction that can be life-threatening. We say these happen within an hour, but usually within 20 to 30 minutes You know if you are allergic. For example, if someone starts to have breathing difficulties, that is a big concern. Or if you are stung on your back of your hands and are itchy, or if you are stung on your leg and you are having trouble swallowing, those are big concerns. All of those mean that your whole body is reacting to the sting. This type This type 1 reaction needs emergency medical care because the patient can die. Do you know? People who have a problem with a bite or sting should call a poison control center. A regional poison control center knows the kind of animal in your area that you need to be concerned about. More people die from insect sting than from black-widow scorpions and rattlesnakes combined. That is how important it is to rule out allergic reactions to flying, stinging insects. We rule out allergic reaction by assessing the patient's ability to breathe, as well as by testing his or her blood pressure. An allergic reaction causes an extreme drop in blood pressure. Interviewer: what symptoms do you look for with a rattlesnake bite? Judge: Jude. It is not as easy to rule out a rattlesnake bite right away because this disease happens in stages. It begins with a puncture wound, possibly with some bleeding. Then you start to see swelling and discoloration at the site of the bite. Hours later, you may see the skin blistering. You can also have tissue destruction, meaning that skin have muscle tissue dies around the site. Bruising that travel over the body is definitely a sign of a snake bite. We draw blood and we measure the part of blood that are responsible for clotting. Snake venom destroys those parts of the blood, so a snakebite patient starts bleeding inside, which makes tissue die. All of this happens over 24 to 36 hours. During the entire time, we give the patient antivenom to try to stop the body reaction to the venom. Last minute. Rattlesnake antivenom costs a patient about 3,000 per vial. One patient was in the hospital for 10 days and received more than 50 vials of antivenom. Along with the other hospital expense, his bill totaled his bill totaled 326,000. How much did he spend on antivenom? How much did the rest of his hospital expenses cost? Non-life-threatening bites and stings. Interviewer: now let's talk about animal culprits that don't cause life-threatening symptoms. What symptoms would you see with a bite of a Gila monster? Good. A Gila monster bite will usually create a little row or circle of teeth marks rather than a single puncture wound. About a third of the time, teeth are embedded with the wound. It is a very painful bite because the Gila monster hangs on for a long time after it bites, have a 2 minute more or more. We say that most people who are bitten by a Gila monster deserve to be bitten. The Gila monster is a very docile animal, and most people who get bitten are harassing one. Interviewer: what about scorpion other than the box scorpion? Jude: if it is not a box scorpion, swelling often develops at the site beginning at a few minutes after the sting. Patients will feel pain at the site and there may be some tingling and numbness. but it usually goes away in hours. The swelling is a clue that it is not a box scorpion sting. With a box scorpion, no swelling occurs. Interviewer: what kind of symptoms do you see with spider bite? Their venom produces local inflammation, but usually no full body symptoms. The only other spider bites the way close attention to are from brown recluse spider. Often you don't feel their bite, but over the next few hours a blister forms at the site. Eventually the blister breaks open, a scab forms and tissue dies. This can cover a large area, and it can last for weeks or months. Brown recluse spider bites usually aren't part of a diagnosis in the emergency room because the symptoms take time to develop aside from a black, white, or brown recluse spider. All the spider bites won't cause any serious problem unless the bite gets infected. Do you know? Snakebite death in the United States is rare, but worldwide it is common. In India, for example, it is estimated that 40,000 people die from snakebite each year. This is due to more deadly kind of snake as well as less access to healthcare. Interviewer: what what about other snakes, Jude? There are many more. There are many more non-venomous than venomous snakes. A lot of snakes we call non-venomous snakes. A lot of snakes we call non-venomous snake. No, non-venomous actually have venom, but a bite isn't as a serious health risk. It can make us feel sore and once in a while blister and swelling develop at the site, but nothing serious. It is estimated that in the United States there are over 35,000 snake bites a year, and 6,000 to 8,000 of them are venomous. Conclusion. Interview: do you have any advice for readers? Besides rattlesnake, almost all bites and stings we deal with happen in and around people's homes. Spider and scorpion are active at night. They seek a dark crack or crevice during the day. You are more likely to come across them at night when they are active, so turning on light at night will reduce your risk. If you see something dangerous and take one step back, you usually remove yourself from the range of danger. And if you leave the animal alone, you lower your risk. More than half the people we treat for rattlesnake bite saw the snake, recognize the danger, and put themselves at greatest risk. If you make smart choice, you are much more likely to stay safe.